morning, and thank you for joining Thompson Hine's virtual program, Emerging from Pandemic, Moving Forward as a Healthy Region. My name's Todd Schild, and I'm the partner in charge of the Thompson Hine Cincinnati office. As the country emerges from the pandemic, our local focus is quickly shifting to focus on building a healthy economy and establishing safe and sustainable ways to operate businesses in a post-pandemic world, interact with each other, and continue to move our region forward. With us today is an impressive panel of local experts to talk about all of these issues as we navigate the new normal in our community. Moderating our panel is Regina Carswell Russo, who's the CEO and Chief Strategist at Right Now Communications and the Director of the Regional COVID Communications Center. I'll now hand it over to Regina and ask her to introduce the panelists. Thank you.
Thank you, Todd. It's great to be here this morning. Everyone could be anywhere this morning, but you are investing in yourself, your team members, your coworkers, and your employees, and we are grateful for you today. I want to first say, take some notes, write them down. This session will be recorded, so we'll give it back to you. There's a chat box right there on the right-hand side. If anyone has any questions throughout this session, you are free to write the questions down, and I will get the answer for you with our incredible, extraordinary guest today. Also, a little bit of housekeeping. If no one is speaking, then if you could have your audio on mute just so that we can hear everybody else. Again, if you have any questions, to put them in the chat. And if you have any follow-up questions, we can provide some contact information for you later because there's a lot of information today. So again, I'm Regina Carswell Russo, CEO of Right Now Communications, which is communications consultancy here in the tri-state. And right now, in the last year, I've been helping the region navigate, live, work, and play safely through stages of the pandemic by offering up uniform, data-informed, culturally competently informed messaging around COVID prevention strategies. And today joining us are two people who have been in the trenches, also helping us navigate through this pandemic. I'll get started by introducing Chris Powell. Chris Powell's with the wonderful glasses and the beautiful plants behind him. He is the CEO of Talmetrics. Talmetrics, everyone, humanizes employee and organizational data to elevate performance and productivity. Welcome, Mr. Chris Powell. And also joining us in the tie and the beautiful paintings behind him is Nathan Tim. Nathan is with Cincinnati Children's Hospital Medical Center. He's been there for like 21 years. He's an ER attending, a physician, medical director of disaster management, and professor of pediatrics. Thank you both for joining me and joining our guests today. So let's get started. Let's start with Nathan. Nathan with the Cincinnati Children's Hospital. Preparing for disasters. Makes sense that you're in the business of helping to prepare for disasters. But companies and employees and employers, sometimes they are not prepared. Tell me about how you took the plan to prepare for large-scale disasters and made it applicable for year-long recovery. Because most disasters, they have a beginning, a middle, and an end. We didn't know when this was going to end. So how did you guys do that?
Brad, thanks a lot. So we, within emergency management in hospitals, have to create a framework that's called an all-hazards approach. So the framework that we put together has to be nimble enough to pivot from different types of scenarios, because it's really hard to create plans for each unique event that might happen. So a water disruption or a power outage or a computer system downtime or a mass casualty event, there's many different types of things that we have to prepare for. And what we have at Cincinnati Children's is an all hazards approach. And so there are 6 key themes that we focus on, so that no matter what the event is, we focus on these 6 things and then pivot within them to make them unique for whatever event we're dealing with. So the first thing is communications. And that we spend a lot of time thinking about how can we best communicate with our employees, how can we best communicate with the community, and then also with our families. So whether it's a network outage or a some other kind of event that's happening on our campus, those are the groups of people that we need to communicate with. And so we've spent a lot of time with that type of work. That was essential for the response to COVID, primarily because it allowed us to have a single voice in how we communicated with those three groups, so that instead of having many different groups communicating with all different sorts of patient populations, we created a unified speaking voice that then would be distributed to through many different venues. So that communications for any type of a disaster or any type of emergency response is always the biggest and most important topic. The next thing we focus on is safety and security. And within that, we incorporate protective services and infection control and then patient safety and employee safety. And all of those things were once again prioritized with COVID as it related to infection control practices, as it related to making sure all of our employees were safe and that our patients were in a safe environment. The employee piece is also employee and business support. What we brought out within this was that business continuity planning that we had worked for years to craft. And a lot of the stuff we do in emergency management looks great on paper, but when we actually put it in place is often a unique event. And this certainly provided that. And so for the last few years, we've really focused our business continuity planning on focusing on how we sustain operations, whether it relates to a network outage or we have employee absenteeism or there's something wrong with the facility itself. And so all three of those things came into light related to COVID. So the disruption of the facility was, well, people weren't working at the hospital. They were working away from the hospital. So how do we manage employees who aren't on site somewhere else? And how do we beef up all of our VPN or our network capacities for those employees? The other piece is patient and family care. That within COVID and in general, how do we create algorithms for care? Early on with COVID, if you remember, there wasn't just a blanket patient population that we were thinking about. It was really based on where people had been and where they had traveled. And that changed almost weekly, if not daily. And we had to manage that in terms of addressing where different people were coming from. And then eventually we got to the point where that travel history just sort of became irrelevant. Resources and assets is another big piece. And this brings into the issue related to personal protective equipment, which I think a lot of people have heard about on the news and the media. And then the last thing, the last of the six is our facility. And this really was a priority within our facility in terms of addressing topics related to social distancing. And how do we create an environment where that social distancing is a priority when in general in pediatrics, we're not really about social distancing because we want to be near everybody and the children want to be near everybody. So how do you create an environment that balances both of those two things?
Chris, I'm going to get to you in a second because we're going to segue into this after this next question. But I want to tell people a little bit about Nathan. In his background, while he was working in pediatrics and working with children, after 9/11 started getting into disaster management. So for years, there are actually people, ladies and gentlemen, who for years work to come up with technology and research and patterns and plans and practices just in case there's a disaster, any kind of disaster, right? So that they are prepared and can prepare the community to get through it. Now, you're able to do this with Children's Hospital, which is one of the largest employers in the region, right? But I'm sure you had employers, Chris, you could probably attest to this. Companies are like, hey, we need some help here. I can't find my binder for communication crisis for a global pandemic. Can you help me? What are the next steps? So how do you now construct plans on disasters in which you are able to help companies move along? Like, what would be the best practice? Should it be a best practice for companies and employees to now keep this at a top of mind and integrate it into their systems for their own long-term preparedness? That would be for Nathan.
Oh, I'm sorry. Yeah, I think that, hospitals were, we certainly get a lot of attention related to emergency management because we are so essential to the maintaining of, the health and safety of our environment. But yes, I think that this was probably topics and efforts that many businesses in the past had never really considered in terms of transitioning people to work from home, in terms of cleaning systems to have in place within their businesses. And so I think that, yes, I think that this certainly gives a new heightened level of awareness for businesses in general of the importance of these contingency plans, because that's really what we do, is we spend a lot of time talking about contingency plans. And so I think for businesses themselves, this has been a good example of the importance of that type of planning.
So, Chris, I want to bring you in here. What was your thinking with this? What was the conversations early on with employers? Like, what do? We kind of have a playbook if we have a tornado or, we have to evacuate maybe if we're working virtually. But this was a year-long disaster. So what were the conversations early on? And tell me what the conversations are now with you have to re-enter back into the workplace.
Yeah, great question, Regina. And Nathan kind of teed it up for me. There are a couple of things I think, if you think about the pandemic and being a major change event, so the change in the event happened. And I think initially a lot of leaders and organizations were thinking, oh, we'll get through this in a short period of time and we'll be able to move forward. But what we saw, to your point, Regina, it was a sustained event and still is to a certain degree. And so what started to shift what we saw in C-suites and organizations was this change from, all right, the change has happened. So how do we start to transition and move through this so that we can come back on the other side of it, back into a thriving position? And so like Nathan was talking about, I think, a lot of companies, and us included, had the business continuity plan and the disaster recovery plan that was in a 3-ring binder that we would look at once a year. And so what we also saw was this movement from what I would call informed leadership to what I would call active adaptive leadership to this crisis. And so, in a lot of ways, there are a lot of technical aspects of this crisis we find ourselves in, and there's some things you can do. But leaders had to figure out who they needed to be in order to move and transition through this. And so I think that's the big thing that we've seen, in particular in the last, say, 15 or 16 months around this, that has changed inside of organizations.
So, like I was saying before, we don't want to say that we can see the light at the end of the tunnel, but we can see that there is something down at the end. Right? Correct. We don't really know like how we're going to get to the other side and what that looks like. And that's frustrating for everyone when we're in a moment where we now have to pivot back into reentry. So we're kind of in another stage of this crisis. People have gotten used to these prevention strategies. They mentally, psychologically have been used to distanced and caution. And now we're saying, come on back, right? We got to open the economy back up. We have to get people back into their offices. We have to learn how to be in open spaces, right? That was all the rage, right? Open work plans. And so now we have to get back into it. How in the world, I'm going to give this to Chris first. How in the world should HR departments, CEOs, and employees, there's 3 different levels of engagement here, start to prepare to re-enter back into the workplace in this juncture? And then Nathan, I want you to take it after that.
Yeah, happy to kick off on this one. As I was mentioning just a second ago, there's the technical aspect of kind of how to think through this. But to your point, it is still evolving and we don't have clarity yet on what this looks like what we're calling the next normal, not the new normal, because it's evolving, it's adaptive, and it's evolving as we go. We're learning more each and every day about this. So I think a couple of things that organizations are having to do. One, this is the first time in my over 20-something years in the area of people and organizations that I've seen in the entire leadership team collectively work and, address this challenge. So it's just not the CEO, it's just not HR, because there's got continuity of operations and service delivery. So it's the entire operation having to come together to solve for this. What I will say is different in this case. This has been a time that HR has taken a more active leadership role in guiding those conversations, because we're talking about the health and well-being of the employees inside of an organization and thinking through that. The one thing I've shared with our clients and with our network of people we work with is that humans transition through these things. They don't necessarily change. It takes us a minute to adapt. And I think one of the things leadership teams are learning is that this is not a quick turn thing. Oh, we're going to say welcome back and everybody's going to come back gladly, because what we're seeing now are organizations are having to try to figure out, hey, are we going to go fully return to the workplace? We're going to go hybrid, or we're going to go remote first. There's all of these things, and these are creating new decision points that organizations hadn't had to think through, which also ends up touching on other aspects of equity and inclusion. And let's not forget about the psychological and physical safety, because there's a continuum on that. I know folks who have not left their home during this crisis, and others who are far more out and active. So I think organizations have, there's not a panacea or a silver bullet, as we used to say, to solve for this. And so that's why we're calling this an adaptive leadership challenge.
Thank you, Chris. Nathan, so take it up from here and tell us from your perspective, what are those steps that you need to really start thinking about to make this next pivot?
So I think that we've, within the healthcare system and within disaster management, there's this cycle that exists, and it's mitigation, preparedness, response, recovery, back to mitigation. And so we've been going around this cycle for about a year now, but right now we're in this sort of response and recovery, and that we're still doing the response phase, and yet we're also trying to move towards some recovery. And what we try to put in place is benchmarks for our recovery, so that we were very clear to say, okay, what is the positivity rate in the community? What's the positivity rate within our employees? What is the rate of the number of children we have within the hospital? What is our metrics related to social distancing? So that as we reach to those measures, as those things all started to come down, we could say, okay, now we're going to make the next step forward, and then be very diligent to say, hey, listen, the positivity rate is now going back up again. We need to sort of either pause our, recovery, and really look carefully at how to continue to move forward. So I think as people, think about moving forward, it's moving forward with some benchmarks that are in place that will allow you to pause if things seem to be changing. And I think that's an important thing for folks to think about, instead of just saying, well, we're just going to open back up and have everybody here, but really be diligent about, well, what are some things that would make us pause that recovery? And I think that's a piece of the puzzle that many folks might not be thinking of. They're thinking of it almost as an all or none, but yet no, it's really a stepwise approach to that recovery.
I want to ask you something, Chris, in a moment about HR professionals. But Nathan, what did we learn from 9/11 when it came to reentry, right? Psychologically, physically, the facilities, infrastructure, moving people back into offices, moving them back into high rises, getting back to working with each other after a disaster, a horrific catastrophe like that. What did we learn from that we can apply as we move through this next stage of the pandemic?
So I think that September 11th was probably the first, major event that happened that was affected the whole country. But in terms of the healthcare system, it was the first push for healthcare preparedness as it related to coming up with systems to deal with biological agents or chemical agents or nuclear event, mass casualty events. That was really the push to hospitals to start that level of preparedness. So a lot of the effort in that early 2000s, if you looked at healthcare, was really revolving around those types of things. The other big event that took place in America was Hurricanes Katrina and Rita. And what that did was really altered the view of disaster management to say, well, listen, let's really think about hospitals and the healthcare system being the victims as well. And how do we then recover when the hospitals are the victims? And Katrina and Rita really reflected that when you saw the devastation of some of these hospitals in New Orleans. And then now we have the pandemic, which I think you can take lessons from all of those things, that you're looking at how do hospitals deal with an influx of patients that have a unique disease and protecting themselves. How do we deal with the hospital as the victim when certain parts of our hospital are now going to be closed and not functioning? So I think the lessons for healthcare systems will stem from those, and it's been this gradual understanding. And unfortunately, we've had to go through these big events in order to get there.
So I want to remind everyone at this moment that feel free at any time that you have any questions. I don't see any questions in the chat, and I know people have questions. Feel free. This is your session. Write the questions down and we can have just a deeper conversation here. This is for you, and we want to tailor make this for you to make sure that we're answering the questions that you want to know. So, Chris, Nathan talked a little bit earlier about communications being essential through all of this, right? And I know that very well. So, and communications, not just with that department, but helping other departments learn how to communicate effectively. But let's talk about HR people. They're the heroes here. They're going to be the heroes when we re-enter. So I don't want to say if there's a hierarchy of who is essential at this moment in this pivot, but who would you say that companies need to really pour into, right? And support, and what are those tools and support? What does that look like?
Yeah, no, really great question, Regina. And one of the things that recently was on another conversation about the well-being of HR professionals during this time, and asking organizations specifically, what are you doing to support those what we in most organizations, in this case, a lot of the front line, in terms of, one, coaching and supporting leaders and managers through the process, and coaching and leading and supporting employees through the process. So they've got a twofer in terms of being able to provide support. So making sure that those folks are well taken care of in terms of their psychological and physiological and safety needs is really important in terms of their well-being. But more importantly, I think, as you think about HR professionals, I think this is a unique opportunity and challenge for all of us in this space to think about, you've heard it, programs, policies, processes. And back to Nathan's point, these scenario plans, and thinking about, all right, how do those need to be adaptive given we don't quite know when people do return to the workplace in numbers. And we know that not everybody's going to be 100% vaccinated just because this is America, right? So what happens in the event if there's an incident of someone contracting COVID after you come back to the workplace? How do you become more adaptive in that and thinking about your programs, your processes, your policies in general? But then you're going to have a mix of individuals, some who are essential, who have to be at the workplace. So what does that scenario look like? For those who are hybrid, what does that scenario look like? And for those who are remote. So I would say it's definitely gotten more complex. And it's going to be an opportunity for us as HR professionals to use not only our scenario planning skills, but our risk management skills, at the same time making sure that we are as in good shape and capability to support everybody through this process. And so I think those are some unique things, in particular from an HR perspective and HR professionals going forward to consider.
So I'm going to take a break here. This is what we call in news a teaser, because we are going to talk about vaccines in a minute, and I know everybody wants to talk about that. But before we get to for the vaccine conversation, we do have a question from Miss Deborah Pearson. Deborah wants to know, Nathan and Chris, what are the tools? What do the tools and support look like for smaller employers, those solo and entrepreneurs? Although not integrating from a staffing perspective, that's not what they need to know. Their need in the absence of a leadership team to reintegrate and protect their clients. Chris, do you want to take that one? What are the tools and support for small employers on how to reintegrate and protect their clients?
Well, the great news here, locally in Cincinnati, the Chamber has put out a lot of great information for not just small companies, but all companies in general. And as a small business owner here in Cincinnati myself, I can say I've used that as a resource quite frequently, not only on helping me think about what I need to do for my teammates and members of the team here, but also as we start to reemerge and return to the workplace and clients want to start exploring the idea of in-person meetings, tips and insights and resources to give me information on how to engage from a higher level of information. I will also say for small business owners, and this is not a plug, but the Society of Human Resource Management, SHRM, has a lot of good content out there in terms of helping small business owners and small HR teams to think through these things as well. So those are two immediate resources that I can think of that I use personally to help me guide me through this process.
Thank you. I would add to that, because the Chamber, Cincinnati USA Regional Chamber, created the Regional COVID Communication Center, and we have a website with the healthcollab.org, RC3, that has some of these resources on there, and also with the Cincinnati Chamber's website to help them through a committee called Restart, right? Yeah. Giving them tools so that small businesses, medium-sized businesses, and large businesses can help navigate through the pandemic. Chris, would you like to jump in here? You're working with major hospital systems, but any particular words of advice for small businesses as they kind of try to reintegrate through this disaster? Nathan, sorry.
So like Chris gave some good resources, and ultimately a lot of those resources are based on the recommendations from the CDC and the Centers for Disease Control. And they have a very user-friendly, frequently asked questions for just about any population within the country. And I know in terms of facility updates, just within the last couple of weeks, they released an update on cleaning practices and disinfection practices related to facilities. And so that's also posted on the CDC website. So if there's questions that need to be answered, that's also a really great resource. That's where we took all of our recommendations from within the hospital in terms of, when we started talking about masking and employee screening and patient screening. All of those things were taken in line with the CDC's recommendation.
I will add that Cincinnati, the region in Southwest Ohio, is extraordinary and leading the country. Yes, leading the country in an example of collaboration of the business community and the health systems working together to help the entire region move forward. Particularly this Restart Committee and the RC3 that is powered by the Chamber and the Health Collaborative. And here's something about the Health Collaborative. They are kind of like the Chamber for all the hospitals. Can you imagine all of the hospitals in this region have come together, pulling resources, pulling information, the best practices to help the community get together and to help employees and employers move through this. So let's talk about vaccines. Right now, everyone has heard about the Get Out the Vax campaign. We're trying to get the region to be vaccinated. 80%, large number, but we can do it because we're amazing in the Southwest Ohio region to get 80% of eligible adults to be vaccinated by the 4th of July. Right now, the region, I think, is at 45%. I don't know what Cincinnati is, but the region is hitting at 45%. So we're inching up there. So Nathan, let's talk about that. Let's talk about what is the temperature now of where we are with vaccine acceptance, and how can we encourage businesses get in the game to help employees understand the importance of vaccines when there's such a different level of understanding and acceptance of it?
So I think that, the best thing that's going on right now is anybody who wants to get a vaccine, anyone being 16 and over, can get one. And there are so many different locations where people can go. The Health Collaborative has an awesome website where you can just click on any number of healthcare systems to go right there. Cincinnati Children's is one of those public providers as well. So in terms of people getting a vaccine, there's no doubt that they can get one in a very short period of time. There will always be a population of people who doubt the effectiveness of vaccines. That is something that, as a pediatrician, I've faced in my life, talking to parents about vaccine hesitancy. And so now when you introduce it on a more global scale, it will certainly get a lot more attention. But Cincinnati Children's was actually one of the 4 sites that was involved with the Pfizer study related to that vaccine. And so that was done right here in Cincinnati, that whole Pfizer vaccine. And they're continuing to work with Pfizer on reducing that age down to show the safety and effectiveness of it. So I think that's the biggest thing, is for folks to know that they can get a vaccine in many number of different places.
So Nathan, let's just do the basics here. Tell me the top 3 myths about vaccines that you want people to walk away from today and know without a shadow of a doubt, this is what you need to know about the vaccines that are at your disposal right now, in case there's anyone who's on this call that has any level of hesitancy about it.
So the Pfizer and Moderna vaccines are extraordinarily safe. That's number one. There was no shortcut taken to creating those vaccines. Vaccine manufacturing has been, with the science, has been ramping up its ability to create new vaccines. And this was just in the continuum of that incredible work that can be done in creating vaccines. And so I think there's a lot of other sort of unusual myths related to vaccines, like they have little transmitters in them and that type of stuff, but that's just somewhat, the most important thing is just to focus on the safety of these vaccines, and they're readily available and they're very effective. They've been just incredibly effective at reducing severe illness and even just the rates of COVID positivity. So I think that's the most remarkable thing about them.
I just want to add in a couple of points here about the vaccine that I would hope that people would know, that we want to make sure that we are saying. Just like we said earlier, remember everyone, when I said earlier that Nathan was one of those superheroes that spent his career just preparing for disaster, preparing best practices, technology, research, what if, so they can put on that cape and do that bat signal and swoop in and help us in case there's a catastrophe. He had the tools, research for years preparing for this. Same thing with vaccines. We did not start from zero. We already had SARS and MERS. So there wasn't like we just started in the laboratory creating a vaccine out of nothing. There was research and there was examples that you had started from in the beginning. There was technology and research that had been developed all along. So again, not starting for research, so was in our favor that there were people that were developing these systems all along. And because the whole world had stopped, economies had stopped, that boundaries were lifted money was flowing to allow research to happen at a incredible speed to accelerate it. And trial vaccines, right? That's another key thing here. Because if someone's not worried about getting rabies, they're not going to go be in a vaccine trial to see what a rabies vaccine is going to be like. But if everyone is affected by a pandemic, you're going to get people who are going to step up and be part of those vaccine trials from different demographics, different ages, different races, and different health conditions, which allows you to test the vaccine and make it effective, which is why this vaccine, Moderna and Pfizer, had the efficacy rate, the highest we have ever seen. Normally, efficacy is 70%, like the flu. The flu is even lower than that, the flu vaccine, right? 70% is amazing. 90% for Pfizer. I sound like a doctor. 90% for Moderna and Pfizer, which is almost unheard of because of this time. One last thing, and I have to get it out there. Not only in some cases will it prevent from being affected by COVID, it almost assuredly prevents you from getting in the hospital and succumbing to the virus. That is what's most important. Without the vaccine, it is a kind of a roll of the dice of how your body will respond, and if you end up on a ventilator. So I think that's something that's very important that people need to understand about the vaccine and getting it. Having said that, Chris, we know, and Nathan, there are people who are still hesitant. They feel it's new. People come to the table with their own reluctance, suspicion, distrust when it comes to science, systems, and process. And so you have all of those people in the workplace. So Chris, give us some tools, and then Nathan, I'd like you to follow, of how do we encourage employees who come to the table with different levels of understanding and trust about vaccines to receive a vaccine? What's the steps? Chris.
Well, no, thanks for that question, Regina. A couple of things, a couple of things come to mind. One, organizations are really good about building the business case for fill in the blank, right? In this case, I think there's the business case for the organization, but more importantly, what's the business case for the individual employee to get vaccinated? And to your point and Nathan's point, it is sharing the data, the insights, and the facts around how getting vaccinated actually is to your advantage. Because I think what, even in my own circles, we've had conversations around the benefits outweigh the risk in my mind in this case, that, hey, if I can keep myself out of the hospital, which means I'm able to stay healthy and working and being able to provide for my family, hey, that's a good thing, right? And so I think as organizations are working through this, and you mentioned communication is a key point. In that business case, start with it from the employee's perspective, and then build into that of the organization. Because the flip side of that is, if we don't have enough of the employee population or the working population vaccinated, that has risk to the organization's sustainability and viability to operate. Therefore, there's loss of jobs. And, you could see the connectivity. And I don't think this is one of these crises that is the first time in my working career that we all are collectively involved and have an accountability and some responsibility here. But I don't always think that organizations do a really good job of talking about the responsibility at the individual level and their responsibility at the collective organizational level. So I think the business case has to be articulated for both, and organizations need to get skilled at how to do that conversation.
Nathan, do you want to weigh in here from a medical perspective?
Yeah, I mean, there's a lot of people have many different reasons why they have vaccine hesitancy. And, not only is there a business model or business choice for why you want to promote that, but also just from a personal choice that there are, vaccines not just help yourself, but they also help all the people around you. That the reason everybody else around you is safe is because everybody else has been vaccinated. And so for people who are hesitant, it's thinking about, well, who am I around? So I have younger children who may have underlying conditions who are not candidates to get vaccine, or I have a wife who is not a candidate to get a vaccine because she has cancer or is severely immunocompromised. And so I think that's another way to approach it, to say you're not only helping yourself stay safe, but then you're also helping all of the people around you. And I think that's another way to look at it, just from instead of just an individualistic approach or a business model, it's like you're doing this to help other people around you as well.
So, I'm sorry, go ahead, Chris.
No, Nathan, thank you for adding the whole piece around the broader community. You're so right. It is that collective component. So thank you for that.
Yes, exactly. And so now we're at the point, where are we here? 10:45. I'm going to ask this question. We might get to two more questions, and I'm going to open up to everyone because I want to hear some other voices in here. So we're going to get a real talk in this question. And for real talk, I need Megan Klawacki, if she's ready to address this legal question. Real talk. Businesses want to open up and they want to get back into the workforce. They want their employees to be healthy. They want their employees to feel safe when they get back, so they can create and they can work together. What do we have at our disposal that in a more aggressive way encourages people to get that vaccine? I'm not going to say mandate. I'm not going to say force. I'm not going to say bribe. I'm not going to say any of those things. But Megan, can you help us here from an employee standpoint? What do companies have at their disposal to encourage this?
Well, we at Cincinnati Children's, we can mandate that people get a flu vaccine because the safety of it has been shown to be extraordinarily safe over many, many decades. With the vaccines that we currently have, emergency use authorization, you can't mandate employees. But I think what you can do is what Chris promoted, just said, listen, folks, the more people that get vaccinated within our group, the more quickly we can return back to relatively normal operations within our environment, that we can have more people back in the office. We can have more people back in our, establishing those personal relationships once again, face to face. And I think that's, aside from just promoting the safety of it and promoting its use, those are really the priorities.
Chris, HR professionals, what kind of tools can we give to the HR professionals? Language, messaging. I know communications people are in high demand right now to help people message their way through these difficult, courageous conversations. But what would you say to support the HR professionals to encourage employees to get the vaccine?
Well, there's a couple of things, and I think HR professionals and organizations are already have evidence of how to encourage. I mean, we all get encouraged every year to do charitable contributions to various different organizations, so we know how to reach out and urge people to take action. So I think it's like making sure, but however, this action is far more personal. And so from a communicating standpoint, that framework of understanding it from the individuals, back to Nathan's point, you've got people on various ranges of the continuum of knowing how to tailor that message such that you get more people to do it than raising more concern. There are a lot of tools out there. Again, the Chamber, the CDC, as well as SHRM all have examples of communication around these things. So I would employ people to go there. I'm not a communications professional, but I know where to go from that perspective. So there are a lot of tools out there that help organizations and HR professionals think through these things.
So I'm just going to say it. Can companies force people to get the vaccine as a term of your to be employed there, to stay employed, to become a candidate, to be an employee? Can you mandate that? Is Megan on the line? Is Megan Glowacki? Elise, is Megan here?
Regina, can you hear me?
Sure, I can hear you.
Great. Yep, from a legal perspective, private employers can mandate or require that employees get a vaccine so long as you are accommodating individuals who have disabilities or who have bona fide religious objections. So it is possible to mandate the vaccine, even though these are emergency use authorization vaccines. The EEOC has come out and said that they would authorize or approve of this mandate. Beyond that sort of significant stick, if you will, employers can also incentivize employees to get the vaccine. There are a host of benefit considerations and legal requirements, but gift cards, PTO or time off in order to get the vaccine. So even if you're not going to mandate that all employees or that certain groups of employees who might be customer or public facing get the vaccine, there are lower sticks that are more carrots, incentivizing employees to get the vaccine. So it is possible to mandate it, to answer your direct question, but even if you are one of the majority of employers who have decided not to mandate, there are, for those who take the permissible approach, there are incentives that you can provide to employees if just the general, we think everyone should get the vaccine isn't enough. One other step further that some of our clients are utilizing are on-site vaccine clinics. So particularly if you have organizations where your employee population just simply hasn't figured out how to get those vaccines that you mentioned earlier are certainly available. An additional tool is to bring an administrator on site to help your employees, line up out the door, get their vaccine. Now, again, there's legal considerations for all of those issues, but I think we're all in the boat of creatively thinking about how we can get everybody vaccinated who can be vaccinated and who wants to be vaccinated.
And I will thank you, Megan. Thank you so much. And I will say that you can find that resource super easy. testandprotectcincy.com. That's the Health Collaborative site, and you can connect with that. You can also connect with me. Todd and Elise can give you my email address, and any employer, company, small business person who wants to investigate how they can bring the vaccines on site, we can help coordinate that with our incredible health systems. There's also some information that I will provide to Todd and Elise to email to everyone. Strategies to increase vaccinations in congregate care settings. This is through the Institute for Healthcare Improvement. These particular strategies can also be employed with businesses. Proven strategies on language, communication, on how to move people from a state of hesitancy to an acceptance when it comes to vaccines. We do have a question for Nathan, speaking about the timing, Pfizer and Moderna vaccines to receive full FDA authorization versus EUA.
So I can't really I don't know the answer to that question. What I can say is that it's likely that there will be a reduction in the age down to 12 years of age at some point, probably within the next 6 weeks or so, at least for the Pfizer vaccine, given the data that's come from Cincinnati Children's and some other sites of the safety of those vaccines in 12-year-olds and above. But I don't know the timing of the full authorization. I know that that full authorization requires other steps and a lot more data and information from those pharmaceutical companies, and I don't know the answer to that question.
Okay. I know it's 10 minutes to 11. I'm going to ask one or two more questions, and we're going to give people a little bit of a time back, and then I'm going to toss this back to Todd. But Chris, can you give us the top three things that employers, employees, but particularly our superheroes here, our HR people, they should be thinking about in the days to come as we get into reentry, and what should be on their long-term strategic plan?
Wow, that's a big one, Regina. Thank you, though. I'll take a stab at it. So what the pandemic created was an acceleration of a lot of things that are already happening. And so the top three things that we're seeing organizations think through as we're moving through this are around making sure that you're rethinking and reimagining your programs, your processes, and your policies. One, to be more adaptive to change, and not just sitting in a three-ring barrier. So that's one of the things. The other one is around manager and leader capability, not only around scenario planning, but also around being able to create environments and cultures of well-being and support. Because one of the things we've seen through our research, that the relationship between employee and manager has intensified because we're working in such disparate ways these days and remote, so that connection to the company is more and more on that relationship between manager and employee. So solidifying or reassuring and reaffirming those leaders and managers to be effective at leading and supporting their teams. And the third one is really around culture, broadly speaking. As organizations are debating and considering, are we fully returning to the workplace, hybrid or remote, what does it mean to be a part of? And that is going to be, I think, the really interesting thing as we move back in, because back to something that Nathan said, that we're going to, if the goal is we're going to get to 80%, and there are going to be those folks who can't get the vaccine and those who just choose not to, this is going to raise a whole nother dimension of aspect for organizations to understand from a diversity standpoint. How do we address that and create a culture where everybody can still be, contribute, and be rewarded and participate, not only at work, but also in the community at large?
That's great. That's a great one to end on, to have us all start thinking about creatively. And this region can pull our minds together. We know we can, to come up with those solutions. Nathan, what would you like to add? And kind of a closing remark right now, what we need to be keeping our eye on.
Well, I think there's some things that will be sustained out of all from the last year's work. And I think the first one, from a healthcare standpoint, is telehealth will be maintained as an avenue for doctor-patient relationships. You know, a year and a half ago, telehealth was really in its infancy and dealing with consultation, and within weeks it went, just up like a rocket ship in terms of how every hospital and healthcare facility was using telehealth. And it's really been a remarkable thing for many families. Instead of having to travel hours to visit their doctor, they can do a telehealth visit in many circumstances. So I think that's going to be sustained. I think Chris loves data, and I think all of the data that the Health Collaborative with Cincinnati Children is really taking the lead on that, all that data related to bed capacity and patient positivity rates and employee, all of that sharing of that information will be sustained with that collaboration into the future, because that's such a powerful tool that we may not, as we look forward in the future, just to have gone through this, that will be a remarkable tool for us to use at some point again. And then the last thing, like what Chris brought up, is workforce resilience and workforce resiliency, and understanding what are the things that we need to do to help our employees and help our staff make it through these difficult times. And once again, a lot of these things we had on paper that we would do, but never had to do it. And now, having gone through it, lots of lessons learned from that. And now we have a good understanding of what we need to do to help our employees moving forward.
Thank you. Thank you, Chris. And thank you, Nathan. I do want to add one last thing, that we're going to follow up with everyone who signed up for this webinar and who joined us today with links to information for Chris, for Nathan, for the Health Collaborative, Cincinnati USA Regional Chamber, African American Chamber, Hispanic Chamber, Regional COVID Communication Center, because the most important thing I think we all have realized is that we have to be informed. And the information is right there, and everyone is willing to provide that information. The more you have the information, the more confident we will be able to move through this next season together and be more well prepared for another event that can occur. I'd like to bring Todd Shield back to the screen to help round us out today. I want to thank everyone for their time and attention and being completely dialed in today. Thank you.
Thanks, Regina. Thank you very much, everybody, for attending today. I found it to be really interesting. I hope you did too. And thank you, Regina, Nathan, and Chris, for your time and participation. If anybody has any final questions, please feel free to put them in the chat or send them to Elise or me at Thompson Hine or Regina, and we can make sure we collect the information and answers for you. Thanks again. Have a great day. Stay safe. Talk to you soon. Thanks very much.